Hello, guys. How is everybody doing today? Once again, my name is Oscar. I'm a board certified physician assistant. And today we are going live. And today we are going to be talking about gastritis. Before we go any further, I want you to understand that this video is for educational purposes only. I'm here to answer some questions, educational questions. We're going to be talking about gastritis, symptoms about gastritis, what is gastritis, and I'm here to help anyone that has general questions. Once again, this is basic, and let me fix a few things here. This is my second live streaming, and a few things were not working. So, okay, so hello, 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 hello. Let me see. Okay. So you guys should be hearing me. So let's go ahead and I'm going to be on for about 15 minutes until about, let's say, 8:25, 8:30. We are live. And I got a few notes here. So let's go ahead and start talking about gastritis. I mean, gastritis is something that you find endoscopically, is the gold standard to diagnose gastritis. Individuals present to the hospital or to the clinic with symptoms of acid reflux, epigastric abdominal pain. Usually, when they're after they eat a meal, they feel dyspepsia. They don't feel well, and most of the individuals happen to be taking some type of NSAIDs, such as Aleve, ibuprofen, BC Goody powders. Also, individuals may be taking medications such as iron supplementation, blood thinners, just to mention a few. So, gastritis is inflammation of the gastric mucosa. It's changes of the gastric mucosa. So that's what it is. It's inflammation of the gastric mucosa. And the worse it gets, the more pain the individual is going to experience. And something that is very common as well is infection with H. pylori. H. pylori is a bacteria that we could get by eating contaminated foods, usually unwashed vegetables, and that's what usually causes gastritis. So, some of the causes of gastritis are new medications, NSAIDs, blood thinners, some iron supplementation, H. pylori, um, autoimmune issues such as pernicious anemia, and those are the some of the causes. How are you going to diagnose it? We are going to, number one, stop the offending agents. If you're taking NSAIDs, make sure you stop it. You need to stop the offending agent. We have to check for H. pylori if H. pylori has not workup has not been done. Make sure you check for H. pylori. Um, and if you suspect something else is going on, let's say you suspect you're experiencing, or as a provider, you suspect the patient may have a gastric ulcer or duodenitis, which is inflammation of the duodenum, then go ahead and proceed with an upper endoscopy. And the upper endoscopy is going to give you a live view of what's going on inside of the stomach. So the it's going to give you a live view. It's going to give you how much inflammation you have. If you have gastritis, duodenitis, gastric ulcer, duodenal ulcer, just to mention a few. And While you're doing the open endoscopy, you may take random biopsies, and the random biopsies are sent to the pathology department, and they will study it to see if you have H. pylori and so on. So that's how you diagnose and look for gastritis. So the most common one is H. pylori, also medications, NSAIDs, um, iron supplementation, blood thinners, just to mention a few. Make sure that I want you guys to keep in mind that this is for educational purposes only for education. I want you to just keep it very basic here, and that's my job, to just provide you with some education. So now that you suspect that the patient or yourself, you suspect you have H. pylori, make sure you stop the offending agents. Make sure you stop the NSAIDs. Make sure you stop the carbonated drinks, caffeinated drinks, fatty foods, greasy foods, red sauces, dark chocolate, just to mention a few. And if you're testing for H. pylori, which you can test two ways, you can test via breath test, and you can test via stool antigen. A few years ago, we used to do blood workup, but that is not good anymore. That we don't follow that at this time. We do the breath test. We do the H. pylori stool antigen. Now, when you're doing the H. pylori workup, make sure the patient has not taken any acid reducing medication for at least 72 hours or so, 48 to 72 hours. Now, if you suspect something else is going on, gastric ulcer, pernicious anemia, um, H. pylori, H. pylori infection with gastric ulcer, then you're going to get that endoscopic procedure, which will give you a direct view on what's really going on in your stomach. And you're gonna go ahead and get some biopsies. And this is the gastric mucosa, and you're gonna get some biopsies, take some biopsies, and send it to the pathology report, to the pathology department. Then we're gonna go ahead and talk about the treatment, how we're gonna treat this. So once again, we go back to stop the offending agents, stop what's causing the issue. If you have H. pylori, you have to treat it with antibiotics and acid suppression. If you have gastritis because NSAIDs, you need to stop the NSAIDs and acid suppression. The treatment will be determined by your primary care physician, by your primary care physician, your physician assistant, your nurse practitioner, your gastroenterologist. They will determine they will determine what medication you should take. Remember, they are the experts. So, H. pylori, antibiotics, acid suppression. NSAID related, stop the NSAIDs, acid suppression. If it is due because poorly controlled acid reflux, make sure that your doctor may give you acid suppression, but also lifestyle modifications, avoiding the fast foods, greasy foods, caffeinated drinks, dark chocolates, spicy food, greasy foods, and so on. Stop that. And then your doctor, your primary doctor, or um, your medical provider will give you and determine the treatment for that. Let's say you have autoimmune gastritis. So you have to make sure to keep an eye on vitamin B12. You have to keep an eye on that. And your doctor may follow up with you more often than normal to assess for all this, because you also may have anemia as well because of it, because you're not absorbing the nutrients. So this is why it's so important to listen to your body And this is also very important for the provider to listen to the patient, because the patient will give you the answer. Excuse me. So it is extremely important for the provider to listen to the patient, but the patient to listen to the provider, because the provider is the one that has the expertise. The provider has seen this many, many, many times. So that's why he is an expert at this. And so it's a mutual work that you have to do. Just listen to your provider. Make sure you stop the offending agents. Make sure you stop the caffeinated drinks, and have a lifestyle change. A lot of people will ask, well, what is it that I'm gonna eat? What I'm gonna eat then? Well, the stopping or changing your diet is is something that you do for a short period of time, and eventually you're going to learn what is causing the issues. And that's when you will determine, okay, you know what, this usually makes me feel sick, this usually makes me bloated, this usually makes me feel doesn't make me feel good at all. So you will be able to determine what makes you sick. And something that a lot of people don't talk about, and it's a fact, that smoking will give you changes in your esophageal mucosa as well as your gastric mucosa. Another thing, vaping. Vaping will also give you an issue in your esophageal mucosa and your gastric mucosa. So, all that is very important. A big no no is drinking alcohol. That's another thing that also causes gastritis. Alcohol induced gastritis. You have to stop that. So sometimes we know what's usually causing the issue. Let's say, as a patient, let's say I'm a patient myself, we know what's causing the issues. We just have to learn to listen to our bodies, because our bodies are a perfect machine, and they will tell you, you know what, this is what's wrong with you right now. I think we need to make some changes here. Some changes we need to do something with our body. So listen to your body. Your body will give you signals on what could be going wrong. Another thing, right now it's 8 p.m. I'm sure a lot of people are having dinner. And something that we have to keep in mind, that when we eat dinner, at least here in the United States, the largest meal is dinner. And a lot of people tell me that they eat dinner and they go to bed right away. And just imagine that food has not had the time to digest. And that food, if you go to bed, then you're going to start experiencing the acid reflux, the acidity. And when the acidity is sitting in the stomach, that's when you're going to be feeling that, or developing the gastritis. You're going to be having symptoms of acid reflux, and that's when you develop the gastritis. So that's how you're going to treat it. It is extremely important for you to listen to your body, lifestyle changes, and you're going to notice how easy it is to have some lifestyle changes. Listen to your body, listen to your doctor, and things will work out on your favor. So, and I'm going to be quoting from my notes as well as the book, but some of the lifestyle modifications to avoid GERD and acid reflux is to Avoid bedtime snacks. So eating late at night. Just avoid that. Make sure you have a somewhat of an empty stomach. So let's say you eat at 7 p.m. You should go to bed by 10 then. You need that 3 hour window. Also, avoid chocolate, peppermint, coffee, teas, cola, carbonated drinks, citrus fruit juices. Now, you're going to be avoiding that for just a few weeks and you and your doctor are working on the treatment. It's just lifestyle modifications. You have to, avoid what's causing the issue. Decrease dietary fat. That's very, very important. Decrease the fat. Decrease the size of the meals. Smaller meals more often. About 6 meals per day. We have to learn from our kids. If you notice, our kids, they eat nonstop. They eat smaller meals more often and they keep going, keep going. So we should learn from our kids because they eat very little, nonstop, and they keep moving. Um, if you're experiencing acid reflux and abdominal bloating and symptoms of dyspepsia, try to also elevate the head of the bed at a 45-degree angle. That helps tremendously. Um, of course, stop. Big two things here: stop smoking, vaping, and alcoholic drinks. They tend to cause the reflux. They tend to cause the changes in the mucosa, in the gastric mucosa, the duodenum, the esophagus right here. It tends to cause changes, meaning inflammation, meaning gastritis. So, in conclusion, here, gastritis is inflammation of the gastric mucosa where the gastric mucosa has become irritated and you feel the symptoms of the abdominal bloating, you feel the symptoms of epigastric discomfort, and that's your body trying to tell you, hey, there's something wrong in the stomach. I'm irritated. My stomach is irritated, so I'm trying to give you a signal. You go ahead and talk to your doctor, your primary care physician, tell them your symptoms. Your primary care physician will either choose to test you for H. pylori, ask you what medication are you taking? Are you taking any NSAIDs? Are you taking any new medications? Are you taking any iron supplementation? Are you taking any new medications? Are you drinking alcohol? Are you smoking? So make sure you be very honest. And depending on the findings that your doctor has, then you're going to be put on a acid reducing medication, stop the offending agents, and if you have H. pylori, then the treatment will be started with antibiotics plus acid reducing. So it is very important to have that lifestyle change. Trust me, avoiding the offending agents and having a healthy lifestyle is extremely important. Very, very important. And I'm not saying, oh, you have to go ahead and be an athlete. No, 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 not at all. Just a healthy lifestyle. So just to close this video is just about 8:25 p.m. here on the eastern side of the United States. Gastritis, inflammation of the gastric mucosa. The symptoms: acid reflux, dyspepsia, abdominal bloating, epigastric abdominal discomfort. How are you going to diagnose it? H. pylori, open endoscopy. How are you going to treat it? Depending on the findings. If it is H. pylori, you go ahead and treat H. pylori plus acid reducing. If it is related to NSAIDs, stop the NSAIDs and acid reducing medication. If it is autoimmune gastritis, then you have to check for vitamin B12 and so on. Guys, I hope you found this video helpful. This video is once again for educational purposes only. I'm here, no one asked any questions, but um, I'm just here to make gastroenterology simplified, simple to understand. I see so many patients on the daily basis, and I just want to make it simple for everybody. All right. If you have any questions, please go ahead and put them below. I read all the comments myself, I respond to all the comments myself. And if you find anything valuable, if you found this video or this information valuable, do not forget to click like, subscribe, and don't forget to follow Gastroenterology Simplified, where we make gastroenterology simple and clear to understand. I will see you in the next one. Bye and have an amazing night.